Hello and welcome. Today, we're diving into a fascinating and relatively common congenital anomaly of the urinary system, horseshoe kidney. We'll explore what it is, why it happens, how it's diagnosed, and what can be done about it. So, what causes a horseshoe kidney? Well, it all happens during fetal development, typically between the 4th and 8th weeks of gestation. The exact cause is still not fully understood, but it's believed to involve a disruption in the migration of the kidneys from their initial position in the pelvis up to their normal location in the abdomen. This disruption often results in the lower poles of the kidneys fusing together. Let's talk about the pathophysiology. In a horseshoe kidney, the kidneys are connected by an isthmus, usually composed of renal parenchyma or fibrous tissue, which crosses the midline anterior to the aorta and inferior vena cava. This connection prevents the kidneys from ascending to their normal position during development. Consequently, the kidneys remain lower in the abdomen than usual. The malrotation of the kidneys, along with altered blood supply and drainage, can predispose individuals to complications like hydronephrosis, kidney stones, and infections. Horseshoe kidney is the most common renal fusion anomaly, affecting approximately 1 in 400 to 500 individuals. It occurs more frequently in males than females. While it can occur in all populations, there is no known specific ethnic or racial predisposition. Many individuals with horseshoe kidney are asymptomatic, meaning they experience no noticeable symptoms. However, when symptoms do occur, they can include abdominal or flank pain, nausea, vomiting, and urinary tract infections. Some individuals may also experience kidney stones. Hydronephrosis is swelling of the kidneys due to a buildup of urine, or rarely, a palpable abdominal mass. Diagnosis of horseshoe kidney often involves imaging studies. Ultrasound is commonly used as an initial screening tool, particularly in prenatal settings. However, more detailed imaging, such as CT scans with contrast or MRI, are typically used to confirm the diagnosis, assess the anatomy, and identify any associated complications. Intravenous pyelograms (IVPs) can also be used, although they are less common now due to the availability of other imaging modalities. While there aren't distinct types of horseshoe kidney per se, it's important to note the location and composition of the isthmus. The isthmus is usually located anterior to the aorta and inferior vena cava, but its exact level and whether it's composed of renal parenchyma or fibrous tissue can vary. Also, the degree of rotation and the presence of any associated anomalies, such as ureteropelvic junction obstruction, should be considered. In many cases, no specific treatment is required for horseshoe kidney if the individual is asymptomatic. However, if complications arise, such as kidney stones, hydronephrosis, or urinary tract infections, treatment is directed towards addressing these specific issues. Kidney stones can be managed with medications, shock wave lithotripsy, or surgical removal. Hydronephrosis may require surgical correction to relieve the obstruction. Urinary tract infections are treated with antibiotics. In rare cases, surgical separation of the isthmus may be considered, but this is usually reserved for situations where it's causing significant symptoms or complications. Unfortunately, there's no known way to prevent horseshoe kidney, as it's a congenital condition that occurs during fetal development. Prenatal care and avoiding known teratogens, substances that can cause birth defects, during pregnancy are always important, but they won't specifically prevent horseshoe kidney. The prognosis for individuals with horseshoe kidney is generally good, especially if they remain asymptomatic. However, the presence of associated complications can impact the prognosis. Regular monitoring and management of any complications, such as kidney stones or infections, are essential. Research continues to focus on understanding the genetic and developmental mechanisms involved in horseshoe kidney, which may eventually lead to new strategies for prevention or earlier detection. Recent studies are also exploring minimally invasive surgical techniques for managing complications associated with horseshoe kidney, aiming to improve patient outcomes and reduce recovery times.